Hi, this is Andrew. Wow, this is so nice. People from California, from Hawaii, from Hong Kong, and from different places, Singapore, Malaysia, oh, a lot of different guys. Okay, great. Hey, great. Let me share with you some of the things that we learned along the week. And that was so interesting because I started finding people, basically, they do not drink enough water. And matter of fact, that's the reason why I thought that would be nice to establish this webinar to let people know that, hey, you know what? You need to drink enough water, and not necessarily water. You can do LOWSUTEA, you can do whatever. But importantly, you have to have the hydration. If you don't, your blood becomes thick. It's so difficult to monitor or manage your, basically manage your blood, thinning the blood. So it is really, at the end of the day, it is so amazing that if we can drink enough water, you better control your your diabetes. So today's webinar will be extremely good to basically allow our friends to better understand how much water to drink. So what we're going to talk about, why hydration is so important to your, to manage your type 2 diabetic. A lot of people don't associate with water actually to diabetes. That is the very interesting point. A lot of people just don't somehow associate water and dehydration. So I thought that, your body dehydration. So it's really important. You have to have enough water to manage your body fluid balance. So in order for you to continue to manage your diabetes. So that's why this lecture is created. 各位朋友，各位今日好高興咧，有機會咧係見到不同嘅人士啦，喺加州翻嚟啦，有夏威夷啦，有星馬泰啦，香港啦。咁所以咧，今日咧點解我講呢樣嘢係要補充你嘅水分咧，能夠更加令到你個糖尿病管理係更加好，或者前期患病者管理更加好咧。咁其實我翻得好多人都唔知點解飲多啲水喎。咁其實咧唔飲多水嘅時候咧，血可能搞得更加 thick。咁我俾啲 study 你就知道，哇！原來飲水係好重要嘅。咁今日嘅講座咧係講樣嘢，咁令到你能夠更加多了解嘅時候咧，飲多啲水係幫助你降低血糖嘅。問問點解會係咁咧嚇 ？OK， 咁我會嘥幾分鐘咧講講咩嘢叫糖尿病啦。So we're going to spend just a few minutes to talk about what is diabetes real fast, so you can get an update. Actually, diabetes is a chronic disease. You don't get well. Basically, you can only do control. And everybody knows that, but I don't think, even though a lot of people know that, they don't seem to, a lot of times they don't associate, but that's okay. And it really affects the entire body blood vessels. Now, really funny, I talked to a lot of diabetic, pre-diabetic now, and they said, oh yeah, I have, my doctor said I have diabetes. But you mean you affect my entire body? I thought only affect my pancreas, or my blood sugar just affect my pancreas, and really don't kick onto them. It affect lots of them in the brain, a lot of them on the heart, a lot of them in the kidney. I mean, is really have not. A lot of these people have not found out that's really the big impact. So truly, why diabetic is so more important than a typical, like, for example, you have COVID-19. That's only affected maybe a couple of years. This will be affected your entire life. Imagine that, entire life. Wow, that will be terrible. So you really got to control your A1C, drop it down to 6.4 and lower. And then the pre-diabetic, diabetic is the same. You just don't want to get yourself to diabetes. You want to prevent yourself from pre-diabetic getting to diabetes. So that, remember, just gotta get that done. So you will not able to get yourself from diabetes to pre-diabetic to diabetic. So you don't want to get into that route, okay? So the control, basically, you have proper dieting, exercise, weight management, and also measure blood sugar, and also listen to webinar to update all the new message. Because I found when you do that, that's why we have that 5 program to hold your hand throughout your diabetic journey. So you were able to understand what to do, what not to do, and maintain the good health. Now, I have the same situation. I'm a registered nurse. I'm an ICU nurse. I know, right? Hey, you know what? Even I know you're not being motivated until the day the doctor said, hey, if you move 1 more point, you'll be medication. Then I start realize, wow, I better do something. I drive my blood sugar down. Now my A1C is 6.0, 6.1, go up and down. But a lot of my patients was beating me. They are now 6.7. Some of them even as low as 6.2. I mean, I was so amazing. They're so motivated and they are in good health. Oh, wow, that's so nice. So to do that, you have to really get your diet control. You have to require your lifestyle change, no white food, no soda, no juice. Now, all these actually take time to change, you know, take motivation. And you have to drink LOWSUTEA because, especially at pre-diabetic, you really have no medication to lower your blood sugar, except you have to, you know, really have nothing. And the doctor said, well, you're going to get diabetic soon, so control yourself. And do majority who know how to control themselves? I found out that majority don't. They will not to eat any dessert, but on the other hand, they still need a lot of rice, you know, spaghetti, a lot of potatoes. All those are the same stuff to drive up blood sugar, and they don't control the blood, the food intake, and they don't exercise. They stay the same. So 3 years, if they don't do much, guess what? They convert. Everybody go through this route, 4 stage. The first stage, there will be first LDL go up, and then the blood sugar will also go up. Now, the LDL, unfortunately, will damage your insulin B cells. This is the B cells that take the sugar into the cells. So when that damage, more insulin come out, it's not going to work. The blood will continue to be thick, second stage. The blood sugar will make the blood become thick and will start blocking the entire body vessels, start blocking the brain, heart, lung, everything. Okay, so you are starting the stage 2. That's why second stage, blood pressure goes up. And then the third stage will come because of the fact that now your sugar continue to go up, your cholesterol continue to go up. Guess what? Then your A1C, which is the hemoglobin, measure the amount of sugar attached to hemoglobin in percentage, it start moving upward also. Now that happened, it will start up at 5.7, moving all the way to 6.4. Once you move to 6.5, you know what? You are diabetic. 6.5 is your mark. And if you don't change your lifestyle, that will happen. So a lot of people will just go through this 4 stage, voila, you will happen. So let's be frank and honest. That is everybody go through that, and you gotta watch out. 嗱，各位堂友，好簡單，糖尿病係永遠唔好嘅，你一定要自己點樣去diet控制啦，即係食物控制啦，要 exercise 啦，要磅數控制啦，同埋咧係點樣減磅。咁你呢個係一世嘅病，唔會好嘅。咁所以變咗嚟講咧，你一世都要開始咧繼續控制你食物 exercise 做呢樣嘢。嗱，個個去咗4個步驟咧去轉糖尿病嘅。第一個步驟就係你個 LDL 個膽固醇上去，咁然後之後咧，咁你嗰個糖亦都上去。咁弊處咧就係個 LDL 上嘅時候咧，就會將嗰個 B cells 喺嗰個胰臟嘅 B cells 咧就會整壞咗佢，咁佢就唔帶啲糖入細胞度，越整越多，就算你胰島素出都做唔到嘢，所以咧就變咗咧嗰啲血同埋啲糖同埋加啲膽固醇咧，就啲血變得好厚啊！當好厚嘅時候咧，就 form 咗好多片塊 all over 個身體。咁就弊家伙啦！呢個咧就全身塞晒所有身體。咁第3個 stage 嚟緊咧，就係你 A1C 就開始高。A1C 係咩嚟㗎？就係個紅血球嗰啲血糖有幾多個 percent 嘅血糖咧係黐住個紅血球。 如果你紅血球咧係5.7係正常，但係一路咁升上去咧就去6.4咧，你就叫做前期患病者。如果你乜嘢都唔做咧，6.5後咧你就糖尿病，3年咧就會轉噶啦。咁所以咧其實咧大多數嘅糖尿病都係咁轉出嚟嘅。咁如果糖尿病咧會翻轉頭啊？唔好意思，唔會翻轉頭嘅。其實你一定喺6.4以下咧，咁你係繼續做呢樣咧，都係翻咗轉頭之後，你都會繼續控制。如果唔係咧，會嘣一聲上去。So we all know the 4th stage. The reason why I keep repeating it, so you guys remember, so that way you have the incentive to continue to really improve your health and management. Now, the sad part is, if you don't do anything, you know what's going to happen? Your risk of stroke is going to be high, your cataract, or glaucoma. And I have a lot of patients now already get diabetic glaucoma. They didn't know until they thought, oh, I think I get short-sighted or whatever. But when they see the doctor, diabetic glaucoma. Once you get diabetic glaucoma, you know what? You can't reverse. You can only control to get worse. So a lot of people actually have that now. And then they also have the pancreas malfunction, whatever it is that doesn't work. That's why LOWSUTEA can help, because it's the insulin booster. The more important is your heart. If your heart is at risk, you have basically, sad part is you have 40-60%, you have a heart issue, a problem, you have a heart attack. And then the worst thing is 70% of the diabetic patient have some form of nerve damage. And that is actually even more important, because the nerve damage is not going to happen. It's going to help you, or not going to help you. It's going to get you to get things that you don't remember anymore. Like, for example, you get a lot of relative which is elderly and keep asking the same question, like every 5-10 minutes. Have you eaten yet? Have you eaten? Wow, you're so so bothersome. I said, my goodness, you asked me about 10-50 times. The reason is the sugar blocked the nerve. They can't remember. And this has happened all the time. And so the high blood pressure is common, and blood vessel damage. And if you get really uncontrolled diabetes, the chances of you is because you have no pain and your leg can be potentially amputated. And then if you damage your kidney, you know what? You have to have dialysis. That would be terrible. Okay. And then 30% of our diabetic patients have no sex function because they can't feel, because of nerve damage. Certainly, if you have pregnancy, you have gestation diabetic, most likely, yes, you are one good candidate in future diabetic. I have a lot of clients also in the same boat. And that result, they become a permanent diabetic because of the gestation diabetic. So keep that in mind. 嗱，各位朋友，如果你乜嘢唔做，你變咗糖尿病咧，你個併發症咧有幾樣嘢，中風啦、青光眼啦、個胰臟唔 work 啦，咁你取咗好年都做唔到啦。40%至60%嘅病人咧好慘，佢係會有呢個心臟病嘅。咁同埋咧腦記憶同埋呢個腦嘅神經系統損壞咧，有70%嘅糖尿病係有呢樣嘢。所以好多人咧或者個婆婆話：哇，問你呢個10分鐘、5分鐘問你一次，話好煩喎。但係其實個原因就係佢嗰啲塞住個腦記唔到啦。咁你血壓高呢個常見㗎啦。同埋咧，嗰啲 blood vessel 一路高落去，又係有個問題。如果你有咩任何損傷嘅腳咧，個 circulation 差咧，你會可能隻腳都俾人斬埋。咁做埋咧就個腎咧會可能損壞啦，咁你就洗腎啦，哇！呢個就更加慘。同埋咧30%嘅糖尿病患病者係冇咗性功能，因為佢冇感覺。咁仲有咧，如果你係糖尿病，你係懷孕嘅糖尿病咧，併發症初時係好翻之後。你係 good candidate， 以後咧可能變咗糖尿病。咁呢個咧就係呢全部咧係我哋有好多我哋嘅糖友咧有呢個問題嘅。所以記住，真係唔好擺落自己去咗糖尿病嗰度，咁就變咗呢啲人問題咧就全部係冇咗啦。咁其實飲去糖茶點 work 嘅咧，就係第一我哋有呢個番石榴葉啦，就 block 啲糖入去個血管裏邊啦，同埋我哋有個苦瓜咧。就帶啲糖，好似胰島素帶糖入細胞裏邊啦。仲有一樣嘢好苦瓜好特別咧，係幫助你啲糖同埋你嘅 cholesterol 鹽咧係睇個尿啊掉出嚟啊。咁所以變咗咧就令到啲糖繼續降低啦。So how LOWSUTEA work is very simple. There's only 2 items in there. There's guavanolines that block sugar get into the vessels. So secondly, the bitter melon, it acts like an insulin, takes sugar into the cells. On top of that, it also takes blood sugar and cholesterol and sodium out of the body through the urine. So net result, your overall cholesterol, sugar will come down, and cholesterol will come down. Your salt will come down. And when that happens, you know what? Then your blood pressure will also come down. It's 3 high going down. Wow, how you like that one? Okay, our company is very simple. Our objective is just to help you to make sure your elevated blood sugar, so you can, if you are pre-diabetic, will prevent you from or postpone your pre-diabetic occurrence. In other words, you would not want to push yourself from pre-diabetic to diabetes with 5 programs. And also, if you are already diabetic, it's okay. We'll help you to continue to lower your blood sugar. Your A1C may be 10 high, that's okay. We'll help you to lower, continue to 5.7, which is the normal blood sugar. Can it be done? Yes, a lot of people actually can be done. I saw so many people actually got that done already, better than me. I'm not a good subject. My cousin was a better subject because they already get down to 5.7, and then we lower. Wow, they are so wonderful. They also be exercise. Besides, we teach them how to diet. They exercise. And the exercise is real difficult. No, they just walk 150 minutes per week. That's done. About every 4 days, every day with 30 minutes or so, you can achieve very easy. And also, they will also lower the weight with BMI less than 23. And then listen to our webinar. A lot today, everybody will listen to our webinar with 20, 30, 40, 50, some of them 50, 60, 100. But they found that was so important. And that will help them to better understand. And then they measure the blood sugar. Now, I'll give you one example. Listen to the webinar, how important. A couple of weeks ago, I guess in November 20th, one of our webinars talked about stroke, right? So you just thought, just learn about stroke. But that helped one of my clients because dad fall out. He started recognizing this guy, his dad is actually getting a stroke symptom just because I understand my webinar. So seeing the webinar, I said, wow, I got to take my dad to emergency rather to the doctor. Now, if he took doctors, that maybe take about 2-3 hours or maybe a couple more days, that the dad, part of the brain damage is severe and he cannot recover that fast. The doctor emergency, wow, you're so good because you brought your dad in like 38 minutes from the actual finding of a stroke symptom. And then he will be right away getting medication, so soften the blockage. And so at the back of the brain, they actually get medication so it doesn't further block and the brain cell doesn't damage, so that recover much better. Imagine that instead of getting tremendous brain damage, and with that, they are actually much better. Net result, you less medical expense and recovery much faster because just listen to the webinar. Wow, that was wonderful. So I was really thankful to people actually listen to the webinar can be that helpful. 嗱，各位堂友，我哋公司咧就5個 program 幫助你 understand 咩叫糖尿病啦。第二咧就幫助你，如果你前期患病唔會變咗糖尿病啦。咁呢個好重要嘅，因為我有5個 program。第一就 diet 啦，飲去糖茶啦，佢點去做運動咧，150分鐘嘅每個月。每個禮拜150分鐘啦，仲有係點控制個磅數啦，BMI 少過23咧，聽我哋書啦，同埋度呢個血糖啦。其實我10月20號有個講座講呢個中風嘅，咁其實咧真係好有用喎，因為我有個堂友咧，佢爸爸忽然間跌倒，咁佢睇，哇，原來佢係中風嘅現象，好彩佢即刻帶到佢唔係醫生，因為醫生可能有2-3個鐘頭、4個鐘頭，咁就弊家伙啦。但係去咗 emergency 咧睇到之後咧，佢個塞嗰度咧即刻係俾啲藥佢能夠通翻，後邊嗰個腦咧細胞唔會繼續損毀，哇幾好啊！咁個嗰個朋友咧就變咗個爸爸咧，會係好大嘅即係嘅損嗰個腦嘅損毀啦。So that's why listen to webinar can be very helpful. You might pick up here and there, but that definitely help you to better understand what is the disease or check it here and there, and might with that end up helping your relative, friends, and you maybe yourself for better health instead of going to a very expensive medical treatment at the end. So today we're going to talk about why hydration is so important for type 2 diabetic management. All pre-diabetic matches the same thing because they really, at the end of the day, if you have better hydration, actually you're pre-diabetic and diabetic, you can better manage. OK， 今日我講緊咧就好簡單嘅，其實點解要飲多啲水咧，係幫助你控制到你個糖尿病嘅管理，或者係前期患病管理一式一樣咯。所以呢個係好正啊。OK。So a lot of people don't realize if you don't drink enough water, it's actually very difficult to manage your sugar and control your diabetes. It's getting more difficult, let's put it this way, okay? So when you're dehydrated, you know what you feel? You feel cranky, you feel sluggish, you feel tired. The reason is the body not pumping enough blood to all the organs, to the heart, to the brain, the kidney, the muscles. You just don't have enough. So as a result, your organs just don't run well because your vessels are not functioning, your blood pressure would drop, because you don't have enough water, your blood sugar definitely would drop. So with that, you will feel sluggish and don't feel right. So if you get further very serious dehydration, actually not even bad for health, you might actually have a life-threatening risk. Imagine that. Wow, that's a lot of people don't understand. The worst thing is because when you don't have enough water, your blood will start to excrete this called stress hormone or the norepinephrine. And the epinephrine will also, what happened is that, hey man, well, I was stressed. So it increased your blood sugar. So really at the end of the day, you are going to get more blood sugar in the bloodstream, which is higher than your normal, maybe up at as much as 200 or 10 or 11 or 12, because your stress hormone will come out because you don't have enough water in there. So today we're going to give you all the tips how much water you drink, what do you have to drink for pre-diabetes, so to prevent you from getting actual dehydration and really minimize your health risk. So today's webinar can help you. Although you might say, wow, how simple that is. But I found out a lot of people, even as simple as it is, they do not know. So important, imagine, remember to drink enough water. OK？ 嗱，各位堂友，其實咧我都覺得哇，係咪咁簡單嘅？好多人都唔知咩叫 dehydration 係咩叫唔夠飲水啊？原來唔飲夠水咧，真係對血糖控制係好難嘅。如果你有時你係啲糖尿或者前嘅話，或者更加弊。嗱，記住咧，如果你飲唔夠水咧，你覺得好攰，好 cranky， 即係好猛震啊呢咁啊。咁因為點解原因係咁咧？因為你個 body 嘅身體咧噴唔夠血出嚟咧，去啲重要嘅心啊、肺啊、腦啊、腎啊同埋啲肌肉。你冇呢樣嘢嘅時候咧，啲人咧就會好攰，因為唔夠水分去嗰度啦，亦都唔夠打啲營養去嗰度啦。咁如果唔夠呢個時候咧，你個血糖咧亦都會慢慢會升高嘅。個原因咧就係因為你血糖咧好特別，有啲嘢就叫做 stress hormone， 呢個 epinephrine 就係 stress hormone 嘅。咁呢個即係呢個荷爾蒙咧會彈咗上嚟就話：喂，我依家唔夠水，準備打仗咯喎，唔夠血睇啦，我就將啲血糖懟高佢，懟高咗佢咧之後，你血糖就會一路係咁高。咁今次嘅講座咧就幫助你了解點解會係咁咧，飲幾多水先夠咧？咁希望咧由呢方面咧就令到你唔會變咗係全部係唔敢夠水，令到降低你即係缺水同埋有一個健康嘅風險。So actually every day, excuse me, I have a little allergy today. I need a cold. Every day. Normal person, you should have at least 100 ounces or 3 liter water to really better blood sugar control. Now, imagine you talk about 100 ounce and 3 liter. Actually, 101, but I just call it 100, easier for us to remember. So 100 ounce water, is that a lot? It's 3 liter. A lot of people, by the way, I asked quite a few of my clients, and many of them is only drink about 1,500 ml, close to 2 liter. And if they drink LOWSUTEA, they're always close to 2 liter, but that's all they have. They don't drink anymore. So really, they still shot 1 liter worth of water. Now, if you can able to drink a little more, your blood sugar will be even better. Especially in Hong Kong, a lot of people are very busy, office, they don't remember. So now I suggest them, hey, get a 1 liter bottle, just like this one, 1 liter bottle. Put LOWSUTEA in there. So fill up 2 bottles, or you at least get 1 bag in here. In the office, you fill up the other bag. Keep drinking. So you know for sure after you finish this, I have 1 liter done. And then you drink another one, I have another liter done. I drink another one, I got 3 liters. So really good. So it's easy to remember. If you drink by cup, you might forget, okay? So the studies show that if you only drink 500 cc to 1 liter, or 17 to 34 ounce, okay, the blood sugar doesn't respond too well. Actually, it becomes kind of impairment. In other words, they don't function well at all. And the dehydration, you got to remember, it increases the stress hormone. It's called cortisol. And that result, when you have stress hormone go up, remember we talked about cortisol before, the glucose will go up, your blood sugar will go up, because it will release some glucose for you to say, hey man, you need something to actually be ready to fight, okay? And the National Academy of Science actually encourage diabetic patient to drink basically about women 91 ounce of water, or 2.7 liter of water. Man, you have to drink 125 ounce of water, or 3.7 liter of water. So almost 4 liters. Imagine that. So this is from National Academy of Science to ask diabetics to do that. But I found majority of my survey, how much water drink, maximum, most of them drink 2 liters. That's about it. If they drink LOWSUTEA, it will be good because they drank about 2 liters. But after that, do you drink it anymore? They said no. And I said, wow, you shot about 2 liters or 1 liter at least. So actually, we have a lot more room. Because after that 2 liters of LOWSUTEA, you can also drink maybe soup, 500 ml of soup, maybe drink other stuff like milk or whatever. You will fill this up. So importantly, really you have to drink more water is better, or LOWSUTEA is better for your health. Seriously, because think about it. If you can drink enough water, your blood becomes not too thick. It will clog up everywhere. So especially with LOWSUTEA, that will be so good. And for men, especially Hawaii people, wow, you go out the sun and there's a heat, and that will definitely can help you to dehydrate yourself very fast. So drinking more water will be so good. And I saw quite a few people from Philippines, same thing. Over there, hot, humid, you would dehydrate much faster. The same thing in Hong Kong, when summertime is hot, you gotta drink more water. So people in Singapore is the same. I saw a lot of people from Singapore. So, hey, this is really a good indication. It's not only 1.5 or 1,500 mil, not 1.5 liter. It's not enough. At least 2, no, that's not enough. It's actually 3 liter or more, because women recommended by the National Academy of Science is at 2.7, almost 3 liters. Man is 3.7. So again, this is really an eye opener for a lot of people. A lot of people say, wow, you need that much? Actually, drinking more is okay, because you get your kidney to flush things out. Especially after you drink LOWSUTEA, you get all the poison out. And a lot of people said, after I did that, I feel much more cleaner. 嗱，各位朋友，好簡單，其實咧好多人都唔知道，原來每日咧我要飲3公升水以上嘅。咁其實咧，原來有3公升以上咧，先能夠俾到一個好啲嘅血糖嘅管理。嗱，有啲好多 study 咧已經睇咗出嚟咧。如果一個男士已經係糖尿病者咧，佢飲500毫升至到1個 liter 嘅水咧，其實佢血糖唔係 function 得好嘅。咁同埋咧，仲有咧，因為當你唔夠水嘅時候咧，你有個荷爾蒙叫 cortisol 出嚟咧，你係會增加你血糖上升。咁呢樣嘢咧就唔正仔喎，因為你血糖上升對你冇益處，係咪？海塞咗好多你嘅血管啊，咁係咪？咁所以咧，其實咧喺呢個 美國嘅國家科學院裏邊咧就話俾佢聽咧，其實咧如果你糖尿病咧，女士咧係要有2.7公升嘅水一日，男士咧係3.7公升嘅水。尤其是當你去行山熱嘅地方嘅時候，你一定要飲多水。飲唔夠水咧，你個問題 cortisol 咧個即係荷爾蒙出現嘅時候咧，就增加你血糖，話對你麻麻地喎，因為你唔想你跟係增加血糖噶嘛，係咪？So the study showed that people who drink less than 500 ml of water per day, the blood sugar will increase more than the people who drink 1 liter per day. So in other words, there's a comparison. If I drink 500 ml only, blood sugar will go up much more than a 1 liter one, okay? And the thing is this, so you always ask why? Why that happen? Well, the reason is when you don't drink enough water, there's a hormone, it's called vasopressin. And it's actually, what it does is it affects your kidney to retain the water so you don't get your water out because you have dehydration, right? They don't want to get rid of more water. Net result of that, the vasopressin also get your liver and say, hey, you better pump out more sugar because I'm ready for fight, war. Now, certainly you don't have war, but you are stressed, right? So your liver will produce more sugar for you for preparation that potential stress. So it will affect your regular insulin also. So hydration really keep your blood sugar more stable. It doesn't go up more. So you really want to get this lower. Now, this study actually came from Stanford Healthcare Diabetic Education Prevention Program. It's not just come from anywhere. So it does show that people who drink 500 ml is not enough. The sugar go up more than the people who drink 1 liter. Okay. So importantly, as I showed earlier, why it's so important to drink, for women, how much? 2.7 liter. For men, how much? 3.7 liters. So it's almost 4 liters, right? So important, keep drinking more water. Or LOWSUTEA, doesn't matter. Now, 各位朋友，如果你係飲咗500毫升一日嘅水咧，如果另外一個朋友有101個 liter 嘅水咧，嗰個朋友啲血糖咧係低過佢500毫升嘅。嗱，我哋個 objective， 我哋目的係繼續去降低血糖啊，唔係整高血糖啊。所以其實飲水咧係好重要，因為喺史丹福大學嗰度咧就有個 study 咧就講及咧，如果我係飲咗500 ml 嘅水，我哋血糖咧就升高過1個 liter 嘅水嘅人飲1個 liter。原來咧，因為當你係飲唔夠水嘅時候咧，你個荷爾蒙咧就會影響呢個腎咧去將嗰啲水分吸翻收快。咁同埋咧，仲有一樣嘢就令到你個肝咧就放啲糖出嚟，因為佢知道話你係有 stress 喎，當你有 stress 嘅時候，個人咧你一定會係affect 咗你個身體嘅。咁所以變咗嚟講咧，好重要咧就繼續咧係要飲多啲水，因為如果唔係嘅話咧，你係繼續係即係呢個唔夠水分嘅時候咧，你血糖咧就高 up and down 嘅。所以呢個唔正係你個 objective 係繼續將啲血糖降低，係咪？So what is the symptom of dehydration? A lot of people just thought that, well, maybe I feel thirsty only. Well, not necessarily, because if you feel thirsty, you get started lightheaded, you feel like tired, lethargy, you feel headache, muscle cramp. This is the sign and symptom is you are dehydration, okay? Now, this is the early sign, which is still can be very easy to treat it by drinking more water. All those will be gone. Now, certainly, I think we have quite a large number of people from Hawaii and Philippines. If you are walking a whole day, walking on a yacht, and then you get a headache, most likely what? You have first sign of what? Dehydration. Okay, that is very common. And I remember when I was in Hawaii, I do yacht work, I feel headachy and tired. Well, the reason is because I don't have water, drinking enough water. So I got a first sign dehydrated. The second stage came, and that it become more important to remember, is moderate dehydration. Now, that's the time you're going to start feeling your lower blood pressure, your pulse become faster, your urine output, meaning the shishi become lower, your skin become dry. When you become dry, you pull up, your skin doesn't bounce back. and then you really need to rehydrate yourself, and also need electrolyte. So you need to basically get your potassium going, and you need to get some drinking water, and you might need to eat one half banana, for example, for dehydrated for diabetic patient. The reason is you need the potassium to get your nerve fiber going. And now certainly if you don't have diabetes, you can get some Pocari because they have a lot of electrolyte sugar, but since you're a diabetic patient, you really can't drink Pocari because there's a lot of sugar in there. So you need to drink water or LOWSUTEA if you want to. You can eat some banana with the electrolyte because banana has good potassium, and maybe sometime maybe some slight salty snack that you can help you to retain more water. So that is something that not very salty, just a little bit salty. So you can make sure that with that very fastly can resolve your problem of moderate dehydration. Now, when you get to be very dehydrated, that's the part that you are really life-threatening. Like you're up in the mountain, walking, really walking to a long place, and then you have lack of water. Wow, you are really potential now, a life-threatening. You're gonna get fainting, you're gonna get seizure, you have the electrical imbalance. At that time, you might need to actually go to the hospital to treat with IV because you get the water going real fast. Now, I happen to see this several times already because I used to go around walking the mountain, and then people walk, and then you see that boom, fainted right there. And then you get him up, they can't get up. So we're gonna cool him off, but he is not drinking because he's not really alert. He can't drink, he doesn't awake. We have to call a helicopter for them to pick him up to go to the hospital. And that happened. And these guys are just exhausted and dehydrated. Well, no, bang, they fall down and they just fainted. They can't get up. So we gotta cool them down, wipe them down. It still took a long time. He doesn't get up. So end up we have to call a helicopter to pick him up to go to the hospital. I saw this before. It's not a really good stuff because as he can continue to go down worse, you know what can happen? He can die. So lucky the helicopter come pretty quick, and they put an IV in there, and once he got the IV in, within 5-10 minutes he wakes up. So, but he's still going to the hospital. So with that, that is such emergency and critical, and you don't want to get yourself in that stage. Lucky we were able to government send a helicopter to pick them up. But if not, wow, that is disaster because you could actually die of dehydration. And you don't want to do it in this stage. And worse that if you can actually faint it, you're in the area, your tongue actually cover your throat, you don't breathe, you die. And that is so sad. And that's happened, documentation of many people like that. And you don't want to be reading at this stage, okay? 嗱，各位缺水嘅症狀咧，如果普通缺水咧就好簡單，你有少少頸渴啦、頭暈啦，你個頭好似好痛咁啦，同埋咧仲有咧就係好攰啦，咁同埋咧仲有咧就有開始有個肌肉咧就會有 cramp 有呢個肌肉嘅收縮啦，咁呢啲咧係常見有嘅抽筋。呢個血肉即係嗰啲咩 muscle， 即係嗰啲肌肉開始抽筋。咁呢個咧係好快脆，好簡單。呢個咧就係一種點簡單咧，就係 basic 咧，飲多啲水或者你開始飲多啲LOWSUTEA咧，已經幫到你㗎啦。OK， 咁但係咧最重要咧要開始解釋呢兩樣嘢咧，就我哋開始講咧，就如果你係一啲叫做中度缺水，excuse me。咩叫中度缺水咧？第一，你血壓開始降低；第二，你脈搏開始快，你開始尿道咧可以係越整越少。你嘅皮膚咧唔係個硬嗰好快撳咗上去，唔會彈翻落嚟啊，好似唔喐咁滯嘅。咁仲有咧就係你會係覺得咧個人好似好攰啦，同埋咧。你係需要咧好快脆咧俾啲水 同埋一啲你嘅電解汁咧，即係個 electrolyte 咧，去補翻呢樣嘢嘅。咁好，如果你糖尿病病者咧，可能要需要食隻半隻蕉啊，幫助你多啲呢個 potassium 啊、鉀啊。咁或者你飲啲食啲叫做 salty snack 咧 ，retain 咗你水喺個身體度。咁啊飲多啲水，咁變咗嚟講咧，你幾樣嘢加埋晒咧，就幫助好快脆咧，係 resolve 咗你個即係中度嘅缺水。嗱，呢個樣咧係可以做得可以好快，亦都可以即刻你做到嘅。大多數啲人就有時你行山嘅時候，或者出邊做工作，忽然間有呢樣嘢，你就好快 resolve 到。OK， 嗱，最重要咧就嚴重缺水嘅人啦，呢個咧係一個好大問題嘅，因為我見過幾次㗎啦。因為我好似時我哋成日行山咧，啲人忽然間 boom 啊暈咗喺度喎，咁我哋幫佢手啦，咁咪唔醒喎，你唔醒咁揾唔到水㗎係咪？咁你就要即係 cool them down啊，咁最後咧我要揾架直升機，即係政府嘅直升機嚟接佢走。咁佢哋係即係要擺個 IV， 即係俾一個擺啲鹽水落個血管裏邊咧，俾啲鹽水佢，咁佢先能夠可能夠好快脆10至分鐘咁上下，佢就會醒翻嘅。咁嗰陣時再俾多啲水啦。所以其實呢樣嘢咧係好多人咧唔了解。如果你嚴重缺水咧，你係可能有生命危險嘅，同埋你健康真係好有大問題。所以 don't want to be 去翻呢笪地方，一定要即係盡量喺你就算係中度血水，你已經解決咗佢咧，咁你冇問題。OK， 尤其是你行山或喺外邊做嘢，呢個係常發生嘅啊，記住啊。So imagine。If you guys are really the one that always going to walk in the mountain, like Thomas, I know you actually like to go walk in the mountain. Make sure you get enough water. If you get a headache, drink more water, drink more LOWSUTEA, so you prevent yourself getting to the stage. Okay, so that will be important for you. Now, a lot of people don't understand how you lose your fluid. Okay, now you lose your fluid is very simple. Well, first of all, you sweat, you lose fluid because you're sweating, losing fluid. Secondly, if you're sick, you start vomiting, you get diarrhea, and then you start all kind of problems because you're infection. You start urinate a lot, and you have fever. The worst that is you have heat. Like in Hawaii, in Philippines, you have a very hot day. Those are really symptoms that you will most likely lose a lot of heat. OK， 嗱，各位朋友記住點解你會塞咗呢個水咧，其實好簡單。第一，你出汗啦，譬如你病啦，你嘔吐啦、肚屙啦，同埋小便過多啦，同埋發燒啦。最重要就係熱，熱咧係一個好大問題嘅。尤其是啲人咧喺出邊工作或者香港咧好熱嘅時候咧，咁你點算咧？哇！你就可能即係缺水缺到好快脆。所以呢個要好重要咧，就真係唔可以缺水。仲有咧就係 what is the common cause for dehydration? Usually the dehydration causes are overexertion. Now, a lot of times people don't recognize the overexertion because, like for example, you're walking up the hill, going to the mountain. It's so easy because you keep walking, exhausted. You're overexhausted, you just thought you're tired. But you can be very easy, didn't understand this is really at that stage of overexertion. And overheating is the same thing. You feel hot, and a lot of times you just feel hot. You start feeling dizzy, but you will continue to walk because you're still miles away, and your sun getting down to you. So overheating, overexhausting are the most very common sign of dehydration. Dehydration. Second is you also have illness. Now, if you are sick, a lot of times that you could actually lose a lot of water also, or you don't drink enough water because you're sick, especially when you're sick of like you have flu, you blow your nose a lot, you cough a lot, you vomit a lot, and you don't drink back the water, you get dehydrated. Simple as that. Now, certainly you have also chronic health condition, and people who have a chronic health. Give you one good example, chronic health. I have an older lady. Unfortunately, she was living by herself, and she was very sick. And then she was so sick that she can't even call her phone. She got so weak. And I found out that it was very simple. She just don't drink enough water. She had very little low electrolyte. So the children did not know and they try to call me. Suddenly they say, "Oh, my mom is really sick," and don't even start recognize people. I said, "Have they drinking water or anything like that?" And they said, "Oh, I don't know." And because they visit the parents, the mom, and then start realizing the mom start not recognize, cannot walk. And I said, well, first of all, you got to take them to the hospital because you really, at the end of the day, this is not a situation you can resolve by yourself. Secondly, you got to give them some water, maybe give them some water that can increase the electrolyte. So at that time, this person actually is not a diabetic person. So I told him I'd give some electrolyte drinks. So they actually drank some PD Sure by Abbott Company. And with that electrolyte, the mom got a lot more weight because they have salt, there is electrolyte with sodium, potassium, and then 3 has some sugar. And net result, after she drank that, she become more alert. And suddenly she went to the hospital. The doctor said, wow, this person is definitely dehydrated. Sodium is very low. And so net result, she's not drinking enough water. And, real funny, after you hydrate that person, she was a total different person. So that my friend was saying, wow, it was very helpful for just a little advice, okay? When you do also a person who drink a lot of alcohol, for example, drinking alcohol is meaning you drink a lot of beer, a lot of whiskey, that also can cause dehydration because you drink a lot of whiskey, but you're not drinking really fluid, a small amount, in whiskey. That can be also cause dehydration. Now, certainly there's some medication can cause your dehydration. Like, for example, LASIK is one good example. LASIK help you to give your fluid out, because they want to get rid of blood pressure going down. So to get a fluid out of the body. So net result, LASIK, when you drink LASIK, you got to make sure that you have enough water to, fulfill your LASIK, but not to overdrink, but at least you don't feel tired, you don't feel weak. That is important. Now, also uncontrolled diabetes, also most likely you do have cause of dehydration. Uncontrolled diabetes is your blood sugar is very high, like 200 and 250, things like that, or 10 to 15, something like that. That is, or even 20 is high. These are uncontrolled diabetes. That is the time that, wow, you gotta really look at, are you dehydrated? Do you need to get very much treated? Because high blood sugar, the next step is really bad, is because your body becomes very toxic, your blood sugar become very acidic. Wow, that is going to be not a good condition for you. So you need to be treated to bring the sugar down. If not, you're going to end up with many more severe actual health problem. OK， 各位堂友，常見嘅缺水嘅原因咧係咩嘅咧？就好多過度用力啊，或者係出去行山啊，你一路係咁行啊，好熱啊，你夠感覺嘅喎，因為你係一行嘅時候，就係啲朋友同你一行嘅時候，你只係繼續好辛苦啊，我叫去啦，因為你有鼓勵啊嘛。但係去到個上就 big bang 咁，你就瞓低咗。咁其實呢個係最多常見嘅東西嘅。咁當然咧，如果你有病，譬如我係感冒嘅，我係咳嘅、肚屙嘅，一路落去嘅時候，真係可能夠缺水缺得好多咯喎。咁你要擺翻啲水入去喎。仲有可能啲慢性嘅病啊，令到你都係咁嘅。嗱，有個朋友咧就係咁嘅，佢其實咧係老婆婆嚟啊。咁佢自己本身咧身體就麻麻地，但係個問題咧，當佢病嘅時候咧，佢真係飲唔夠水。飲唔夠水嘅時候咧，可能佢飲咧成500 ml 都唔出奇。原來佢唔夠鹽啦，唔夠即係鉀啦，咁佢成日軟晒，搭唔到電話，搭唔到，行唔到。咁佢細佬去探佢嘅時候咧，喂，佢點解佢打電話俾我話嗱？第一我話你咧可能要叫10字車，第二咧佢話你不如去攞去樓下睇下買到個叫做 PD Sure 喺雅培出嘅，俾啲佢飲下先。 咁 pretty sure 有好咧，就有鹽啦，有鉀啦，有糖啦，幾樣嘅俾佢飲咗之後咧，佢係醒翻好多啦，但係都唔應該仲係自己照顧咗，咁佢帶佢入醫院啦。咁醫生話俾佢聽，哇！你原來個身體嘅鹽分好低喎，所以佢咧好低嘅時候咧，佢連即係普通見人就行唔到，見人唔識啦，行唔到啦，好弱啦。呢個係一個重要嘅東西，所以老人家咧一定要佢繼續係身體點健康咧，真係要好唔好俾佢缺水，同埋仲有咧要俾佢個 electrolyte 咧，即係嗰啲身體嘅鉀啊鹽啊，一定要好好處理，同埋咧仲有陣時咧，老人家有啲藥咧叫LASIK咧，係放啲尿出嚟咧，等佢唔會個血壓高嗰啲咧。呢個又要注意咯，因為你唔知噶嘛，係咪啊，老人家？咁仲有咧，如果diabetic如果係糖尿病失控嗰啲咧，亦都有同樣嘅問題。因為點解糖尿病失控咧？因為太多人失咗控佢之後咧，弊家伙啦，佢血糖好高，咁佢嗰陣時咧就多數咧，即係佢個水分咧，亦都唔係飲好多水啦。咁呢個咧就會 end up 咧有缺水、血糖高。咁啊比較好危險嘅啫，有啲人去15嗰啲咧就一定要飲翻多啲水，或者飲得唔係多水係啲糖，有啲去糖茶，開黃降低翻個血糖先。如果唔係咧，你去到20嗰啲要去醫院嘅。Okay, so severe dehydration, can it be a life-threatening? I can tell you, yes, you can. As I mentioned, people can be fainted, can be seizure, if they're a lot of electrolyte imbalance. They need IV solution and can be really life-threatening. Now, because a lot of people, when they fainted, the tongue dropped down to the airflow, so they are so weak they can't move it. They just choke themselves to death. So 50 to 25% of the dehydration, it is life-threatening. So you can be very sure, especially I saw, as I mentioned, people walking a mountain together. They're dehydrated, fainted, and we have to call a helicopter because no matter what we do to them, they don't wake up. So the helicopter came about 10, 15 minutes. They put an IV in there, 5, 10 minutes, the guy wake up. So very, very simple, but very true that they have to make sure they really do not get severe dehydrated. Okay? 嗱，各位朋友，如果嚴重缺水係咪有心危險？Definitely 有心危險，因為當你暈咗嘅時候咧，你暈咗嘅時候，可能個脷咧跌咗去嗰個喉嚨嗰度咧，你唞唔到氣，同埋咧你唔知有咩問題出現啊。咁你嗰陣時候咧，你太過弱啦，你喐唔到啦已經。咁我亦都有個比例就話我即係有 example， 頭先咧就講及我行山嘅時見咧就暈咗咧，哇叫極都唔醒，我哋有抹身啦，又俾啲扇潑啦。哇，10零分鐘都唔得嘅，咁我哋又唯有叫個直升機嚟接佢啦。原來佢擺個 IV 落去嘅時候咧，即係俾個膠管入去血管裏邊嘅時候咧，佢哋大概5至10分鐘佢醒㗎。咁變咗嚟講，即係缺水係好緊要嘅。同埋如果15至25% 嘅人缺水係真係有生命危險嘅，所以呢個係唔可以唔重視啊。So really, at the end of the day, what is the tips? Get enough water to manage your diabetics. Okay. So 今日依家我再講下其他嗱，你頭先講咗乜嘢叫嚴重嘅嚴重嘅缺水啦，有普通缺水、中度缺水、嚴重缺水講咗啦。咁依家咧就講下，喂，咁點處理呢樣嘢啊？點解頭先我哋講咗話，如果糖尿病嘅，如果你唔缺水咧，你個 stress hormone 會走上嚟嘅。So we already talked about basically why you need water to manage your diabetes, right? Because if not, your stress hormone goes up, your blood sugar goes up. And how do you manage your typical dehydration, moderate dehydration, and also your severe dehydration? So we'll talk about that now. So we'll talk about tips now how to manage your diabetes. So very important. You actually have to manage your electrolyte. Why this is so important? Because you need to have sodium, potassium, or chloride to get your body function. Now, if your potassium going down, you know what happened? Your nerve doesn't fire. So it doesn't fire, so you can't really get your body to act because your body just like saying that I want to move my hand. It won't move because you don't have enough potassium to send next signal to your nerve. And sodium and potassium work together for that purpose. You don't have that, you have lost that communication function, if you will. So that result, your body function just doesn't work. Okay, so as the #1 diabetes as a tip is that you have to have proper electrolyte to get yourself work. If you are severe or you are not severe, you're moderate dehydrated, as I mentioned, how do you get more potassium? Eat a little bit more banana. So with the banana, because of a lot of potassium, will help you go up. And put a little bit salty snack, not a lot of salty snack, but a little bit. So you get a little bit more salt and potassium come in, then you can able to at least get your nerve fiber start moving and make your basic body start functioning. So important, drink water or LOWSUTEA with some salt, snacky, some salt snack, or some little bit banana. The salt will retain the water, so it will help you to improve your dehydration. So that's the #1 tip. Okay. 嗱，各位朋友，如果你第一樣嘢，第一個 tip 咧就要有一個好啲嘅穩定嘅電解質嘅東西。嗱，咩叫電解質咧？就係鹽啦，同埋你個鉀啦，同埋你個 chloride 啦，氯化啦，呢個東西喺個血裏邊咧係有喺度嘅。咁其實鉀同埋呢個鹽咧係幫你啲個 nerve 即係個神經系統去行嘅。冇咗嘢，你隻手喐咧，佢喐唔到嘅，唔夠鉀，唔夠即係唔夠signal去到嗰啲個血嗰個神經系統咧去話俾你手喐。咁嘅時候咧，你有一個好大問題啦。所以你首先咧，你個 electrolyte 要好嘅，唔可以話唔可以唔好，因為唔好咧，你就變咗咧嚟講唔夠呢啲嘢咧，你個人又會好攰啦，同埋要加少少鹽嘅東西咧去。俾你個水分繼續留低喺個身體裏邊，唔會掉出去啦。Okay, so important stabilize electrolyte. First tip. Secondly, if it's too hot, you get really dehydrated. You know where the temperature is high, especially in Hawaii, the temperature is high as 95 degree Fahrenheit, or in Hong Kong is 32, 33, or Philippines, same thing. So really, if this is really a hot day as a diabetic, you need to actually check your blood sugar, because extreme heat tend to actually move your blood sugar to be up. Okay. Now, especially if you're walking in a mountain, it's so hot day, and you want to test the blood sugar, you got to make sure keep your testing strip to be dry, because I also talk with some of my friends who actually do mountain walking. They will test the blood sugar. Unfortunately, the strip they want to test are wet, so it doesn't work. So it's not good. So really, at the end of the day, those two items, you have to really extreme heat. You got to test the blood. At home, definitely you can do it. But especially when you go up to the mountain, wow, so hot, you cannot really check your blood sugar. Then it's not going to be good. So it's so important to keep your strip, maybe put it in a sealed zip lock plastic bag to make sure it's dry. So put the tester, the stick on there so you can check. And while you actually with the very hot, drink LOWSUTEA, because LOWSUTEA help you hydrate, plus lower your blood sugar, drop your blood sugar down, which is really good. Matter of fact, if you can not only drink 8 cups, you can drink a little more, 2,500 ml, 10 cups is okay. Just put a little more water in there and put it in and drink that. So you continue to lower your blood sugar at the same time hydrating yourself. So it's a very simple formula. So second tip, hot weather, measure your blood sugar, drink LOWSUTEA. Very simple. 嗱，各位朋友，如果個天氣太熱啦 ，OK， 咁你係缺水嘅，咁點算啊？最重要咧係真係要咧係 make sure 咧，你有呢樣嘢嘅時候咧係俾到啲當你係上咗山上有時行嘅，喺屋企冇問題。如果好熱嘅時候咧，你要度你血糖， 因為點解代血糖咧？因為血糖嘅時候好熱嘅時候，可能血糖好高嘅，咁你要做嘢點做啊？或者飲多啲呢個去糖茶啦，飲咗去糖茶飲幾多啊？咁嗰陣時咧，其實你唔係飲就係8至10杯啦，可能要10或者12杯都得嘅。你飲多啲去糖茶嘅時候咧，咁佢啲糖會降低啦，同埋啲水分咧會幫助你係降低你嘅缺水嘅問題啦。咁所以變咗兩方面咧都係可以做到嘢喎，係咪？嗱，好多糖友依家同我行山嗰啲人咧，佢講咧飲咗去糖茶嘅，佢買一大樽依樽咁嘅嘢整好咗，佢買2樽添。咁如果佢真係要飲多啲，咪飲多啲咯。對佢嚟講係冇任何問題嘅，因為佢能夠降低個血糖，仲有咩啊？幫助你缺水。Okay, so important if you act to drink a little more, even a 3 liter of LOWSUTEA, that's okay because it will help you lower your blood sugar at the same time, and at the same time it hydrate you. Plus, if you are heat very hot, second tip, take your blood sugar. Very important, take your blood sugar so you know where you're at. Now, another one is the third tip is while you're walking, you can, or while you're out in the heat, you take some hydrated snack. Like for example, take some very icy kiwi, very icy fruits with you. And that way, I found that actually get some icy pear or icy, berry would be also very good. Icy meaning very cold. Because eating a piece of icy berry or not frozen grape, but icy berries can help you actually lower your, maybe because your diabetic grape might not be as good, but berry is really good. So do take berries, ice berry or strawberry is okay too. That will help you to actually lower your, because icy, so it will help you hydrate, but it's cool you off at the same time. OK， 各位朋友，如果你係去上緊山啊，要好熱嘅時候咧，咁你食咩零食會好咧？食啲好凍嘅，譬如好似梨啦，凍梨係好正㗎，因為梨係一個唔係一個low glycemic food，所以食咗梨咧係幫助你係可以降低即係會 cool you off， 同埋咧降低你個 hydration 啦。咁變咗嚟講，亦都唔會整到好高嘅血糖啦，或者會食嗰啲唔好食grape 未必一定好，最好食咩咧？就食呢個叫 berry 啊，食呢個strawberry 啦，士多啤梨啦，藍莓啦，呢啲係個好嘅，但係一定要 ice 啊。咁點做 ice 啊？我未去行山之前雪凍咗佢，擺喺個袋裏邊，擺個一個啲咁嘅即係有凍袋啊。咁能夠令佢 keep 住凍咧 ，it will be very good. So take hydrated snack with berries or pears. This can be very good. Now you have to continue to measure your thirst, and that how do you do that? You have to pay attention. Because a lot of people forget about while they're doing walking up, and they forget about looking at that. So the blood sugar could be high due to they don't have enough water. And then you don't keep your blood sugar stable. The key is keep your hydrating so your blood sugar continues stable, not to go up here, go down. That's not what you want to do. You want to keep it as stable as possible. So really, maybe one more choice to keep is put this LOWSUTEA icy, cold LOWSUTEA. And a lot of my friends, especially who are in Hawaii, in Philippines, now they drink LOWSUTEA cold. In a hot day, they drink that. They really felt that they can hydrate themselves, feel that much better. So keep that in mind. Keep LOWSUTEA in a very icy. They actually make it night before, and they make 2 bottles LOWSUTEA with ice. Wow, it's very delicious. OK， 咁記住，朋友記住咧，就係能夠咧係重要點咧，就係。記住，如果你係頸渴，如果你係要睇下你自己係咪缺水，咁如果你係缺水嘅話，或者糖會高嘅話，咁其實咧好重要咧，就要飲翻啲嘢咧係降翻你血糖。飲咩睇啊？凍嘅去糖茶。嗱，因為咧好多人咧唔知咧飲凍去糖茶係好舒服嘅， 尤其是我好多朋友依家喺夏威夷啦、菲律賓啦、香港都有啦。佢飲咗去糖茶凍嘅話咧，哇！尤其是做 exercise 飲去糖凍嘅時候咧，係幫助佢降低血糖。再做一樣嘢降低咩啊？降低佢個 dehydration， 降低佢缺水嘅問題。呢個係十分正嘅。So in conclusion, first of all, dehydration really can make your blood sugar control very difficult. And dehydrated can be dangerous because it makes your blood pressure fall, you can be fainted, and because of the fact that when your dehydration, your hormone will increase this thing called cortisol or epinephrine, increase your blood sugar. And each day, normally, we're supposed to have about 100 ounce or 3 liter water we drink. But majority of people don't drink even 3 liter. They drink 2 liter or 500, 1 liter or 1.5 liter. That's about it. So they don't have enough water. That is an issue for everybody. You have to know your symptom of dehydration, such as thirst, headache, muscle cramp, and so forth. You got to remember that, because with that, so you got to be treated right away. Drink LOWSUTEA, eat some fruits, and so forth. And the reason is because in all of the tips to give you prevent you from dehydration is because you want to have a very stable electrolyte. If your electrolyte is screwed up, you don't have enough salt, you don't have enough potassium, you know what? You feel very weak. You can't even walk. You can't even get up. You don't want to get, even you want your hand to move, you might not able to do that because you don't have the electrolyte to get your nerve to fire. And so with that, you gotta replenish your electrolyte very quickly, like eating a banana, salty snack, and so forth. You have to check your blood sugar when you have extreme heat. Poke your finger or use the Abbott Libre to check your blood sugar, because you want to make sure that when you have extreme heat, you will replenish with some LOWSUTEA to make sure you get yourself hydrated very fast, lower your blood sugar, or some frozen fruits, like for example, frozen berry to help you. And then pay attention on your thirst. If you are really become thirsty and so forth, drink LOWSUTEA to help you lower blood sugar, and so make sure you hydrate. 各位朋友，好多人咧都唔知道，原來咧，如果你缺水咧，如果你缺水係普通缺水冇乜問題，嚴重缺水係生命危險嘅。咁其實咧，呢個對你講，因為佢如果嚴重缺水，你血壓會低咧，會暈咧，可能唞唔到氣咧，同埋仲有一個重要點咧，就係如果缺水嘅時候咧，你係有一個stress，咁個 stress 咧荷爾蒙上高。上高之後咧就做咗一個 epinephrine 或者係一個 cortisol 出嚟咧，就令你血糖會上高。咁你 make sure 你個 objective 就唔係想你血糖高啦。咁而其實咧，每日咧係應該飲3公升水嘅，3個 liter 水嘅。飲唔夠個血糖真係唔能夠控制，亦都常會高。咁其實咧，如果你係有覺得哇我係缺水嘅時候咧，好多時第一樣嘢就頭痛啦，個人好攰啦，有肌肉嘅收縮啦，或者會有 cramps 啦，咁變咗嚟講，呢啲咧就要好快飲啲糖咧，飲啲水係降翻低佢。如果你糖尿病咧，就飲多呢個去糖茶，能夠快脆降低你血糖，就降低你個缺水嘅現象。其實你重要點咧，就要穩定你嘅電解質。電解質裏邊有咩？有鹽，又埋有呢個鉀啦。呢樣嘢咧係幫助你啲 nerve 咧，你個 nerve 去 fire 嘅。如果你冇呢樣嘢咧 ，nerve 唔識 fire，你做嘢都唔識做，你好攰又唔識做嘢，又唔識暈陀陀行唔到路。咁其實咧，當你好熱嘅時候咧，你一定要咧係 check 你個 blood sugar。你個 blood sugar 係咪高咧？如果你血糖高嘅時候，你就即係飲多血糖茶降翻低佢啦。同埋仲有或者要食啲 icy snack 咧，或者 snack 係咩berry 啊，或者食嗰啲個叫做strawberry 雪凍咗佢咁你能夠令到有啲凍嘅東西入去，亦都幫助你咧係有啲糖。咁同埋仲有咧就可能夠有食啲有少鹽嘅小食咧，就令到水咧就係能夠係放喺身體裏邊。咁仲有一樣最後啦，要知道話幾時我就好頸渴啦，或者我真係依家有缺水嘅開始現象 咁好重要咧，就飲去糖茶。飲去糖茶咧係最好，你能夠飲2公升，飲多啲就怕3公升都 OK 嘅，因為你要繼續降低血糖，亦都繼續 hydrate 你自己。Okay, this is my lecture today. I appreciate you spending time with me to learn about dehydration. Sorry for slightly over time, but I think it's an important subject because look like a simple subject, but on the hand, it's also a very important subject. And I will answer some of the questions now. Okay, so the question, the first question is, what is the recommended daily fluid that for people who are man and woman, and why woman is, I guess the man and woman, actually there is some difference on man and woman, by the way, because women tend to have a little bit more, less active, I would say. So net result, that's why they drink more. But important daily fluid intake recommended by men is 3.7 liter. And for women is 2.7 liter, or woman is 91 ounce and man is 125 ounce. Now, why there's a difference? Because in the sciences at National Academic Science, they were saying that because women tend to be not as working more or more, and men go out there, they have to do sport. So they figure, and also the size of women are usually a lot of times is smaller frame, so the amount of water they need is less. But naturally, they really need to have 3 liter of water, or 2.7 is close to 3 liter. Man and 3 is just a little more, 1 liter more, because we probably man have a lot more activities, and so that's why the daily fluid recommended for men is slightly more than women. And typically, that's how they recommend it. They actually do study typically women's activities, men's activity, and that result after they finish, okay, the amount of activity. So it's really activity, weight, and size related. So that's the reason why I recommend in average 2.7 liter for women, or 91 ounce for women, and man is 3.7 liter for men and 120 pounds for men. Okay. 男女點解係會有多啲少啲？因為女士咧個 activities 咧工作量可能少咗啲啦，同埋運動少咗啲啦，唔會好似男士咁多啦，同埋個 size 我哋男士大啲噶嘛，咁所以變咗飲水咧，所以變咗係3.7係男士，女士係2.7。Okay, it is better to drink liquid throughout the day, or can one drink in 1 or 2 setting? Okay. Actually, that's a very good question, Eugene. Actually, it's good to drink throughout the day rather than you drink one big time in the morning and then you don't drink anything until one big time at night, because you want to body continue to hydrate. And that's the reason why now I actually carry a bottle with me all the time. I carry a LOWSUTEA with me, this bottle. Actually, I drink with me all day long. And after I finish this bottle, I make another bottle, and then I drink it for the rest of the day, the second time, or even at night. If I drink more, I just 1 more bottle. So actually, it's a very good suggestion, really. I bought 3 of this 1 liter bottle, and basically I filled it up every night. And basically, I just put 2 in the refrigerator. And what I do is when I need 1, I just take it out and drink. And if I go out, I always take 1 with me. Even on flight, when I take an airplane to overseas or to area, you cannot have water, right? So I put a dry LOWSUTEA bag in there. When I go on the board, I just ask the stewardess, can you give me some hot water filled up to the top? And they always do that, no issue. And then I can whole flight, I will just keep drinking it. Certainly with that, you also come 1 more thing, you have to go restroom, but that's okay. You are continue detoxing, and I measure my blood sugar. Wow, it's always been very good. It's always lower than 120 and going down to like 110, 100, around there. So it's really continue to maintain my blood sugar between 110 to 120 range. And it's very nice. So I feel hydrated, I feel good. And if I go up to the mountain to walk, the same thing, I got icy LOWSUTEA with me. So it is better to drink liquid throughout the day, not one drink in the morning, one drink at night. That's actually, you can, but it's not as good. The effective is keep drinking throughout the day so you continue to be hydrated. 各位朋友，另外一個 question 咧就係、喂，我係咪一日飲一朝飲咗好多水先，晏晝飲多啲水，或者晚黑淨係飲一大杯水咧？其實咧最好咧就慢慢即係樣樣飲啲嘅，即係每一個鐘頭飲些少啦，最低限度飲200毫升啊 OK 嘅。咁就唔好話即係一飲好多嘢，晏晝多。咁其實我去搭飛機又係，我係攞住2樽水，但係個水未必沖咗嘅，我擺係膠嘅，擺咗一個茶袋裏邊咧。咁上飛機又叫好公司俾啲水我啦，或者如果行山咧，我整定2支凍嘅水咧，一路行一路諗啦。咁其實咧，我度翻血嘅時候就睇到自己，哇好正喎！我血糖咧唔會高 up 嘅喎，我係成日都未聽6以下嘅喎。咁咪幾好正係咪？咁變咗嚟講咧，你就可以繼續咧去行山，亦都冇個行山嘅血糖降低血糖嘅風險啦，亦都幫助你係繼續係能夠保持你血糖嘅平穩啦。咁係 OK 喎，係咪？咁所以變咗嚟講，嗱你睇下我今日咧飲咗血糖咧，我都係4.9嘅啫。OK， 今朝到依家係早高咗一啲，係早餐食早餐食8點鐘食咗早餐，然後之後依家飲咗血糖茶。4.9 正唔正 ？So my blood sugar right now is around 80 something point. So it's really good. It's only 5. So it's very good sugar. And the reason is because of the fact that I have been drinking LOWSUTEA. And so I drink it along the way. I don't just stop here. So that's why it's good. What do you mean a few frozen grape? How many grape? Due to grapes being sugary? Actually, that was a mistake. It's actually not grape. Actually, it's berries. I think that was when I typed this out. Actually, I put berries in there. I don't know when my staff would change it to put grape. It's actually berry. It's best to eat berry. Strawberry, blueberry is good. Not grape, because grape is too sugar. You're right. You're not to get grapes. Frozen strawberry is good, or blueberry is good, not grapes. Thank you for the spot on, okay, correction. 有個預知好叻，佢問係咪如果食呢個凍嘅葡提子係咪好啊？唔 OK， 因為如果糖尿患病者咧，如果食凍嘅葡提子咧，因為糖太高啊，咁其實最好就係食士多啤梨或者食藍莓。呢兩樣係雪凍佢咧，啲藍莓好似其實雪凍嘅藍莓好似一嚿冰咁嘅，好食嘅嚇。咁你試下呢樣嘢咧，會幫助你係降低血糖。So really at the end of the day, just get berries. Strawberry or blueberry is the right choice. Okay. Actually, if you have correlation of dehydration, the next question is there a correlation of dehydrate to my glucose reading? Absolutely, there is. When you get dehydrated, you know what? Your blood sugar usually go up. The reason is when you dehydrated, your blood sugar will recognize that, wow, you know, your sugar goes up because you are stressed. Your cortisol hormone see you are stressed, it pump up more sugar to help you to prepare fight. So net result, when you're dehydrated, you know what? Your sugar will go up. Your epinephrine also get you to pump up more sugar. So net result, overall, your blood sugar will go up. So there is definitely a correlation. If you are dehydrated, your blood sugar goes up. And if you are heat in a hot day, and that's what your blood sugar also will go up, because the same thing, because you're stressed, slightly dehydrated, you will actually get your blood sugar goes up. So 當你如果係好熱，如果你係缺水，你個血糖會高啊，會上升嘅。所以呢個咧係一定會有一個關係，因為血糖上升嘅原因就係因為你會有 stress。 個 stress 咧，你個 cortisol 個荷爾蒙咧就令你血糖上升。咁夾俾泵啲糖出嚟準備打仗啊！咁所以變咗嚟講咧，你就會血糖上升嘅。So it's important to put your dehydration or eliminate dehydration, decrease your stress, so your sugar doesn't go up. Objective is always lower your blood sugar. It's not saying, oh, it's okay, short term. No, you want to lower your blood sugar to continue to maintain your blood sugar to be low so you can be continually healthy. That will be the things that you do. Well, thank you very much, Eugene. Thank you for a wonderful question that you asked. Are there any more questions that I can help you with so I can able to answer? Wow, that's good. Thank you. Have a nice weekend. Thank you very much for your time sent to us, and thank you very much for always so even your busy time can joining our webinar. And thank you for all my friends from Hong Kong, from Hawaii, from Vancouver, from all the places like Los Angeles, Thomas, Philippines. Thank you again. We hope that this lecture can help you to learn better why dehydration is important, diabetic management. And I will get you more lectures and we'll continue to go from there. And I wish you all a very Merry Christmas and a great and happy New Year. So take care and looking forward to see you soon. Take care. Bye-bye.